If you've noticed your energy fading by mid-afternoon, your hair thinning more than usual, or your skin losing that healthy glow it once had, you might be dealing with something far more common than you realize. And here's what concerns me most as a physician. The solution has been hiding in plain sight, yet millions of seniors have no idea they're deficient in something their body desperately needs to function properly. I'm Dr. Sarah Chen, and today we're talking about a deficiency that affects roughly 42% of American adults, with rates even higher among those over 60. But before we dive in, I want you to do something for me. Hit that subscribe button and drop a comment telling me where you're watching from. Building this community of health-conscious individuals keeps me motivated to bring you evidence-based information you can actually use. Let me start with a story that probably sounds familiar. Last month, a patient came to my office complaining about feeling weaker, more tired, and frankly, older than her 65 years should make her feel. She'd accepted this as normal aging, but after running some basic blood work, we discovered her vitamin D levels were critically low. Within 3 months of addressing this deficiency, she reported feeling like a different person. Her energy improved, her muscle strength increased, and even her mood lifted. This isn't an isolated case. It's a pattern I see repeatedly in my practice. Here's what's happening in your body when vitamin D levels drop. This nutrient, which functions more like a hormone than a traditional vitamin, plays a crucial role in cellular communication throughout your entire body. When levels are adequate, your cells receive clear signals to grow, repair, and maintain themselves. When levels are low, it's like trying to have a conversation through a bad phone connection. The signals get through, but they're weak and unclear. The consequences show up everywhere. Your hair follicles need vitamin D to stay in their active growth phase. Without it, they prematurely shift into a resting state, leading to thinning hair and slower regrowth. Your skin cells require vitamin D to produce collagen and repair daily damage from environmental stressors. Your muscles depend on it to maintain strength and prevent that gradual decline toward frailty that so many seniors fear. Now, you might be wondering why this deficiency is so common, especially among older adults. There are several factors at play. First, as we age, our skin becomes less efficient at producing vitamin D from sunlight, sometimes producing up to 75% less than younger skin. Second, modern lifestyles keep us indoors far more than previous generations. And third, dietary sources alone rarely provide adequate amounts, particularly if you're not regularly consuming fatty fish or fortified foods. So what can you actually do about this? Let me share some practical, research-backed strategies. Start with sensible sun exposure. I'm talking about 15 to 20 minutes of morning sunlight on your arms and face, ideally between 7 and 9 a.m. when UV rays are less intense. This isn't about sunbathing all day. It's about giving your skin a brief opportunity to do what it's designed to do naturally. Next, focus on food sources. Fatty fish like salmon, mackerel, and sardines are excellent choices. Aim for 2 to 3 servings per week. These fish provide vitamin D alongside omega-3 fatty acids, creating a synergistic effect that benefits your skin, joints, and brain health. Egg yolks from pasture-raised chickens and fortified dairy products are additional options worth incorporating. For most seniors, however, food and sunlight alone aren't enough. This is where supplementation becomes important. I typically recommend vitamin D3, which is the more bioavailable form, at doses between 2,000 and 4,000 IU daily for my older patients. But here's a critical detail that many people miss. Vitamin D is fat-soluble, meaning you need to take it with a meal containing healthy fats for proper absorption. Taking it on an empty stomach significantly reduces its effectiveness. There's another piece of this puzzle that's often overlooked. Vitamin D requires magnesium to convert into its active form in your body. Without adequate magnesium, all that vitamin D you're taking or producing essentially sits there unused. Include magnesium-rich foods like leafy greens, nuts, seeds, and whole grains in your daily diet, or discuss supplementation with your healthcare provider. Here's my professional recommendation. Get tested. Ask your doctor for a 25-hydroxy vitamin D blood test. Optimal levels generally fall between 40 and 60 nanograms per milliliter. Knowing your baseline helps you and your doctor determine the right approach for your specific situation. Remember, addressing vitamin D deficiency isn't about reversing aging or chasing youth. It's about being the healthiest, most vibrant version of yourself at whatever age you are. It's about having the energy to enjoy your life, the strength to stay independent, and the confidence that comes from feeling good in your own skin. If you found this information valuable, share it with someone who might benefit. And don't forget to check out my other videos on healthy aging. Until next time, this is Dr. Sarah Chen reminding you that small, consistent changes create remarkable results.